Hey everyone, welcome to the second episode of Health Equity Mondays. You're joined by Jasmine and Omari, and today we're going to be talking about the East Palestine trail derailment and maternal health, specifically Black maternal health.
If you missed our first episode and are new to concepts of health equity, you might want to go back to that one and take a listen. That's where we break down all key definitions in terms of health equity.
Yeah, and just so you all know, or as a reminder, this is a monthly show. It's going to be released on the last Monday of every month. So just be sure to look out for it then. Be sure to share, like, subscribe. We greatly appreciate that. And to get into it, want to check in. How are you doing, Jasmine?
Hey, welcome to Health Equity Mondays, hosted by Jasmine Leonard
and Omari Richins. Here we'll talk about all things health equity, public health, and culture.
Let's do our part to move health equity forward and all that jazz. I'm excited. My birthday is next week. The 1st of March. And I also, if you're watching this on video, you might notice that I don't have on glasses. So I recently had corrective eye surgery, so my eyes are healing. And it's just been an exciting time. So I'm good. I know how you're doing, but you might want to tell everyone how you're doing and how your last week was.
Right. Well, firstly, happy early birthday to you. I think that you're doing you have a birthday link that we're going to put in below where people can go to your Amazon wish list if you're interested in supporting Health Equity Jazz, helping celebrate Jasmine for her birthday. And yeah, that's cool that you don't wear glasses anymore now. I guess that is very different from who you used to be and someone who wears glasses.
Oh no, so hold on. I will clarify. I will still be wearing glasses because it's a part of my personality, but they just will be cuter glasses.
Got you. Well, at least you've been given the ability to get cuter glasses now, so that's awesome. And as you asked, as most of you all can probably hear, I've lost my voice. I'm currently in Trinidad and Tobago. I played Carnival this week. It was a lot of fun, but my body is recovering, and we're doing well. We're doing a lot better than yesterday. Tested negative for COVID yesterday. But I was feeling decently out of it. But we're out here having a good time. Definitely go to Carnival next year. If Trinidad is definitely the best one, but if you go to any other carnivals, it's always a good time regardless. So that's my tip to visit Trinidad.
For our friends that don't know about Carnival, that's the equivalent to Mardi Gras, kind of, right? What is that?
Mardi Gras, but more vibes. If you don't know about soca music originates from the Caribbean, and it's just a lot of soca music. It's like a festival. My partner said it's like Coachella times 10 because it's not just concerts, but you're literally on the road. You're walking about a marathon. I burned 4,000 calories each day I was out there in the hot sun, but it was a good time, spending it with friends, enjoying the music, enjoying the culture. And it's the first carnival since COVID came. I played in the last carnival right before COVID, and that was interesting. But this time was a lot of fun. So once again, advocate if you're interested in doing something like that, definitely check out Trinidad Carnival next year.
I think maybe we should do our show from Carnival next year. I'll come down and we'll just do it, right?
Hey, we could definitely figure something out. That's for sure. All right. Well, to get into the episode, and excuse my voice once again, but we're going to talk about the East Palestine trail derailment. As you all might have known if you've been watching any news, this happened earlier this month, February 3rd to be exact. And it was a Norfolk Southern freight train carrying hazardous materials. It derailed in East Palestine, Ohio. The train derailed because there was some mechanical things that happened. I believe there was an overheating in the wheel bearing that led to the train derailment. And I believe as well, Jasmine shared with me that some of the train conductors were warning the company that they weren't putting the right precautions in place to ensure that this type of stuff wouldn't happen. And I think that in itself is a public health equity topic, or something that we should think about. How are we preventing these types of things, and what are the protocols that are being put in place to ensure that we don't have trail derailments and we don't have a lot of hazardous waste being pumped into communities that are affecting not only people but animals and people's livelihoods. And just to give like a bigger overview of the East Palestine, Ohio region, it is a very small, I think it's considered a village, not even a city, and I think that's because it has a declining population. It has a population of about 5,000 people. And what's interesting is that 98.2% of the population is white. Yet it's a very impoverished region. The median income is $35,000. The per capita income is $16,000, and 10% of the population lives below the poverty line. I would imagine that it's probably higher than that, but hey, I didn't do the data. But what has been what has been coming up a lot is that a lot of people have been getting rashes, having nausea, having trouble breathing because these contaminants have leaked into their communities, whether that's the air, the water. So as I said earlier, the train derailed on February 3rd, and this is an article from CNN. And as you all know, all articles are linked in the description below, so be sure to check that out. But the train was derailed on February 3rd, and what was most interesting, I feel like this entire article is very interesting, just understanding the timeline of what was happening. But February 3rd, and then when we go to the bottom of the article, we see that it was only on February 21st that the state opens up a health clinic for residents who worry the symptoms such as trouble breathing, rashes, and nausea might be linked to the derailment. So it happened 3 weeks after the derailment actually happened. And if you go down a little bit lower here, you will see that the EPA is not happy. They are not happy at all with this organization. They are essentially telling them that they have to clean up every single piece of debris, all of the contamination, to the EPA's specifications and satisfaction, or they can pay $70,000 a day essentially, and hopefully that money goes towards the community and supporting the community and ensuring that people are taken care of, because first and foremost we need to take care of the people that are affected by this issue that they had nothing to do with. They were just living their lives and this happened to them. And one other thing I wanted to highlight was just the concept of One Health, because I was reading another article where I think it was 43,000 deaths of animals, not people, animals, a lot of fish and birds that were killed, that I think it's the EPA and another organization estimated. And some of you might know about One Health, but I thought this is important because, okay, so firstly, One Health is an approach that recognizes that the health of people is closely connected to the health of animals and our shared environment. One Health is not new, but it has become more important in recent years. So it really focuses on people, animals, environment, and the interrelation there. And I think, like, as public health people, we should all be thinking about how those things are related and how this affects us, because not when, or I should say, when one thing happens and it affects the animals or it affects the soil, then it affects so many other things and has an impact on our health. So I think it's just important that we're focusing not only on what is happening to the humans, but focusing on what's happening to the environment and the animals, because that has potential consequences that may come to humans in the future. So we'll be keeping our tabs on this, and hopefully the people that are affected are able to get some sort of relief and are able to not have a lot of chronic diseases and things that come up from this type of environmental health hazards that come up.
Yeah, this is sad. And honestly, I think it's important that we highlighted the demographics, because had this been a rich white area of Ohio, I don't think it would have taken them 20 days or so to actually put up a health clinic, and to believe the people that are saying that they are struggling to breathe and having issues. So it's just all around sad.
Yeah, and I think I'm glad that you highlighted that, because we want to ensure that, like, health equity, though a lot of our conversations are going to be focused on the Black plus population perspective, there is health equity issues within the white population, especially when you're looking at the stratification of population by socioeconomic class or by income and stuff like that. So yes, there are disparities everywhere.
Unfortunately.
Right.
Which brings us to our second topic, right? I don't know why I always pull the short end of the straw and have to like do the really hard ones. But it's fine. It's fine. No, I wanted to talk about this topic, maternal health, because, you know, clearly I'm a Black woman. And actually, if you've been following me for a while, you know that Health Equity Jazz essentially spawned from a video that I created entitled From Sarah to Serena, which goes over stories of Black women who have experienced medical mistreatment, and then essentially links that to current health disparities that are Black women facing. And so it's one of the reasons I get to sit here and do this work with Omari, because somehow we got connected after I did that. So it holds a special place in my heart. But yeah, so even before I created that video, I could easily tell you, without even having to Google or think about it, that Black women are 3 to 4 times more likely to die than white women during pregnancy or due to pregnancy complications. And I don't know about y'all, but my news feed has been inundated with article after article after article about the current state of Black maternal health in the United States, and none of it is positive. And I wish I could say that was different, but I can't. And so we're going to go through a couple of the articles, and then discuss why this is happening. And, you know, I hope that y'all kind of know, but we're going to let y'all know if you don't. Okay, so the first article that we're going to discuss was written January 7th by Haley Weiss, and essentially it's a study that says that the wealthiest Black moms are more likely to die in childbirth than the poorest white moms. So, you know, this is part of the conversation that seems to get lost when we think about income. We think, oh, well, if more people are making more money, then that's great. And unfortunately, Black people, Black women do not really get the benefits of having more economic stability. So an important part of this article states that, in fact, the effects caused by structural racism are so strong that even the wealthiest Black women and their newborns experience worse outcomes than those from the lowest income white families. In other words, the maternal health gap is a trap of systemic racism with roots so deep that no amount of money can buy a Black woman a path out of it.
Wow.
I don't know. I don't know about y'all, but it just doesn't feel good to me. So that was January 7th. Then we get to January 27th, and we get an article from Mississippi. All right, so on January 27th, we got an article from NBC News that says the Black maternal deaths and disparities increase in Mississippi. Black non-Hispanic women had a rate 4 times higher than white non-Hispanic women, according to a report released Thursday by the state's Department of Health. If you know about Mississippi, you know that it is a beautiful place, a beautiful state, and one of our friends, Joy Washington, is from Mississippi. But unfortunately, it tends to rank the lowest in terms of life expectancy, in terms of adequate nutrition, BMI, all of the things that essentially link to chronic disease. And of no surprise, we're now getting data that it is a 4 times more likely chance of Black women dying than white women. So again, 3 to 4 times is the national average. I've seen it as low as 2 in some states, in some areas. But Mississippi, again, unfortunately, is leading in having a disparity 4 times more than that of white women for Black women.
Wow.
If, you know, we were not depressed enough, we got even more data that came in. And let's see. So our next article comes from California, and kind of similar to the first one, but this is a New York Times article. Okay, so 2 weeks ago, the New York Times published an article that says childbirth is deadlier for Black families even when they're rich, an expansive study finds. And this data is unique to California, so, it's not like we can't assume that this is the case for all of America, because California is a pretty good indicator for what happens in the rest of the country. And they have a large population, so we can do some inference here.
And they tend to have better health outcomes than most other states. And to see this data, it just really is disheartening to know that even when they have a lot better health outcomes, the health outcomes for Black mothers are so poor.
Yeah, so one thing that we wanted to highlight from this article is that this study, and again, we'll link everything so that you can take a look yourself. So this study, published last month by the National Bureau of Economic Research, includes nearly all the infants born to first-time mothers from 2007 to 2016 in California, the state with the most annual births. So again, this is why we really can use this data and think about what's happening in the rest of the country. For the first time, it combines income tax data with birth, death, and hospitalization records, and demographic data from the Census Bureau and the Social Security Administration while protecting identities. So a lot of times when we're dealing with public health data, it's siloed. We have data that is based on income that is in one spot. That's usually from the credit bureaus and all of that. Then we have data that Social Security keeps on everyone with births and deaths. Then we have hospital data. And then we have, like claims data and things that are going to give us diagnoses. And none of these systems talk to each other. So it becomes really hard for public health professionals to get a full view, a holistic view of what's happening with their population, because all of the data is in different places, and it's not until we get the funding and the money to do large-scale studies like this that we can come out with these landmark novel papers and articles that really give us a true indication of what's happening within the country. So, last article, 3 days ago, Forbes. Okay, so we're not even in, a public health journal. We're not in a normal, I guess, newspaper. So Forbes. So the money people are even talking about this. And honestly, it's the article that made me just say, yep, I feel you. So Maya Nagel Hoskin wrote, "Black women are dying during childbirth and no one seems to care." Honestly, as a Black woman starting a motherhood journey, this is how I feel most days. And again, we will link the article so that you can read it, but she basically highlights a lot of the facts that we just discussed from these articles and explains that this is not new. We have known that Black women were dying more during childbirth, during, pregnancy complications, after childbirth, within the first year, the postpartum time. We've known this for years, and it's not getting any better in any way. It's increasing for most places, most states. And, I don't know how many times we're going to have to ring the bell before someone actually comes and cares about this. But yeah, this is why we had to talk about it. So there are a lot of reasons for this. And Omari and I are going to go through some of those so that we can inform you all on what's happening, why it's happening, and, maybe find a solution. I don't know.
Yeah, well, thanks for sharing that, Jasmine. As sobering and disheartening as it is a reality of what is happening. And I think it just shows how important this type of work is and how timely this type of work is, and why you need people like you all listening to this to be empowered to take actions to ensure that we are creating better health outcomes and not having these kind of outcomes that we see here. Okay, so there are many complex reasons for disparities in Black maternal health, including systemic racism and bias in the healthcare system and society as a whole, And me and Jasmine are going to go through, I think, 5 factors, and there are probably a whole host of other factors that you can think of. And let us know. Comment below, DM us, and let us know if there are other factors that we missed that you thought were important as well. So the first one is racism and bias in modern day healthcare system. In this article, which we linked here, they just talk about a lot of how we feel black patients in pain. So half of white medical trainees believe such myths as black people having thicker skin or less sensitive nerve endings than white people. And they look at the different false notions, and you can go through this article, but it really highlights all of those things there. And so towards more equitable treatment of pain, I like how they talk about like collecting data, because I think that's central to health equity work, identifying our own biases. In our first episode, we spoke about how it's important to identify our biases, no matter if we're black or white, to ensure that we recognize what biases we have, and then we can work to address them. And just knowing that this is an ongoing cycle, it's not just a one and done. So no one course or class is going to teach you everything that you need to do to fix your biases, because we have been societally programmed or raised or conditioned to be with these biases. So I think it's just important to understand that. So establish educational programs, yet we need a little bit more than that. Remove as much individual discretion as possible, and continue the search for objective measures of pain. So black women are often subject to implicit and explicit bias from healthcare providers, leading to inadequate care and mistrust of medical professionals. This can result in delayed or inappropriate treatment, misdiagnosis, and dismissal of symptoms. Have you heard of the 2016 research study of white medical students?
That's the one you just did.
The one I just showed, that
so
is
you
linked
did it,
below.
Yeah.
Right. It found that nearly half of the participants held false beliefs about biological differences in black patients, including thicker skin and less sensitive nerve endings. And one anecdotal story that I can share is when I was in Alaska doing my community health fellowship, one of my co-workers, who's a white lady, was in the hospital, and she was talking about this black lady who was in a hospital, and she was in pain, but she didn't want to ask for help because she thought that she would be seen as a disgruntled black lady, and it led to her death, actually. And I think that that's so important that we are able to advocate for the things that we need, because nobody deserves to die during childbirth, whether that's the mother or the infant, and unfortunately it is disproportionately the case for black people. And I'll pass it on to Jasmine for point 2.
Again, I get the hard one. So historical trauma, and I hope that now you're starting to think of all the things that have happened in history that potentially could impact black women. So if we start at the legacy of slavery, then we move to Jim Crow laws, and now where we're living in this idea of institutionalized racism and medical mistreatment at the hands of white scientists and doctors. All of this has resulted in a culture of distrust between black people and the medical community. And honestly, it's rightfully earned. I don't understand why we still have these conversations of, well, I don't understand why black people don't trust us. Because y'all have not been great. And an example, James Marion Sims. I hope that this name is not new to you. I hope that you know how despicable this man was. So, in case you don't know, James Marion Sims is typically called the father of gynecology. I will never refer to him as that because, honestly, that's disgusting. This man, and I guess you could have said he was a doctor, but I'm sorry, I don't feel like he was a true doctor. But basically, he experimented on 30-plus black women, all in the name of science. All in the name of, I want to learn about gynecology. And of these 30 women, we only know 3 names: Lucy, Anarcha, and Betsy. If you Google them, there are new public health groups that are wanting to really highlight these women as essentially the mothers of gynecology, because it's through their bodies that we essentially have all of the modern day tools that are used, including the speculum, the position for vaginal exams, and all the things that have essentially evolved out of the OBGYN space. I want to be clear that he performed these surgeries all the time without anesthesia. At the time, it was not widespread. But honestly, I think even if anesthesia had been something that everyone was using, he probably wouldn't have, because we just talked about it. There's this sick belief that Black people don't experience pain in the same ways, and he likely would have ascribed to that and said that they didn't need it. And so it's trauma like this that Black women carry in our DNA. It's a part of us. It's a part of our story. It's a part of our parents' stories, our mother's stories, our grandmother's stories. And one of the things that we'll talk about later, it all accumulates in our bodies, and it's one of the reasons that the maternal health disparities are so prevalent.
So number 3, socioeconomic factors. Black women are more likely to live in areas of poverty, food and medical apartheid, and have limited healthcare resources, including prenatal care. This can lead to higher rates of chronic health conditions and increase the risk of maternal mortality and morbidity, as well as infant mortality and morbidity.
And because we used a term that I like to use, I'm going to just quickly state that food apartheid, medical apartheid, you probably have heard it as a food desert and a medical desert. I like to use the term apartheid because a desert is naturally occurring, and absolutely none of what exists in this country is natural or something that has to be as it is.
Thank you for sharing that.
All right, so number 4, lack of diversity in the healthcare workforce. If you are following me, you know that I have been ranting about this as I am trying to find a Black OBGYN, a new Black primary care provider, and it is like finding a unicorn. And unfortunately, the healthcare workforce has not really changed in the past 120 years in terms of the proportionality of physicians, and especially Black physicians. A 2021 UCLA study found that the proportion of physicians who are Black in the United States has increased by only 4 percentage points over the past 120 years. And the share of doctors who are Black men remains unchanged since 1940. Okay, we're in 2023, just for context. So the Association of American Medical Colleges just recently updated their data, and I will share what they said. Their 2021 data, there are essentially about 950,000 active physicians. And if we go down, this article is mostly about specialty type, and that's not what we're going to focus on. What we're going to focus on right here is this number. Black or African American, 5.7%. 5.7%. That is the percentage of active physicians who are Black. Granted, some physicians might not have stated their race, they chose not to respond, but that's the data that we have. And let's go back to our first time with you all, and the population of Black people in the United States is about 12 to 13%. So this is a disparity. If we want to discuss inequity, we would have to discuss the barriers in place to keep Black people out of and from graduating medical school, including cost, standardized testing, internship and research requirements, networking and legacy advantages, a lack of adequate supports and advising, and so much more. And honestly, as someone who was in medical school, that could be a whole nother podcast. All right, Omari, wrap us up.
Absolutely. And number 5, chronic stress. Black women are more likely to experience chronic stress due to racism, discrimination, which can lead to adverse health outcomes such as preterm birth, low birth weight, and preeclampsia. The idea of chronic stress being linked to poor maternal health outcomes is not new. Dr. Arlene Geronomus famously formulated the weathering hypothesis in 1992, which I'll share in a second. According to Geronomus, black women experience chronic stress due to the exposure to social and economic inequalities, discrimination, and racism. The chronic stress leads to physiological responses known as allostatic load, which refers to wear and tear on the body's systems as a result of chronic stress. This allostatic load contributes to the premature aging of black women, as their bodies are forced to work harder to cope with the chronic stress, thus increasing the potential for pregnancy complication and death. And I think this talks a little bit more about the epigenetics and how stress is being tied into our genetics as people, and especially as black women, carrying the stress and trauma, not only from these historical traumas that are happening, but as well from seeing many black bodies being murdered countlessly across the country, and a whole host of other health inequities that are affecting black populations is causing issues that we yet are to know the extent to what the issues are that are coming out from all this historical trauma and the chronic stress that arises.
Okay, I got to do my vocab check. So what's epigenetics?
That's a great question.
I got you.
Thank you.
Okay, so you know that we have to break down words that we use that may not be commonly known. So Omari mentioned epigenetics. So epigenetics is the study of how your behaviors and environment can cause changes that affect the way your genes work. Unlike genetic changes, epigenetic changes are reversible and do not change your DNA sequence, but they change how your body reads a DNA sequence. So I think a lot more has started to come out about epigenetics and essentially how, as I was saying, we carry trauma in our genes. And these are things that don't have to be there, but because so much has changed, so much has happened, so much trauma has happened in our environment and within our communities, our bodies essentially have internalized that, and now our DNA is changed.
Right, and that's important. And if anyone knows an epigeneticist, let us know. We'd love to have them on the show to share more about their research and their knowledge and expertise around this topic. So addressing these disparities will require a multifaceted approach that includes addressing systemic racism and bias in healthcare, increasing access to resources and support for black women, and improving diversity and cultural competency in the healthcare workforce, as well as just ensuring that we have competent and strong leaders that are coming up that are willing to challenge the status quo and willing to do the work to really shift these systems and create more health and better health outcomes for black mothers and for everyone. But we know that we have to focus on the people that are most affected, and by doing that, we will successfully help everyone else.
Because I really don't like the anxiety that I have around the idea of becoming a mother because I know too much. So I would appreciate if we could fix this.
Right. And I know, Jasmine, it's your birthday coming up. You said it earlier on. So did you have any promos or any other thing that you wanted to share before we get into health equity in the culture and then get out of here?
Yeah, so I do have an Amazon wish list. So if you're following me on IG at Health Equity Jazz, it's actually pinned. Like, that's how obnoxious I'm being. And honestly, let me explain. I'm not trying to be obnoxious. I have been embracing a year of radical self-love, and if you know me in real life, gifts and people loving on me, it makes me uncomfortable, but I'm trying to embrace that because I know, one, that's like some ways that's people's love languages and all that stuff, and honestly, we all deserve to get flowers while we're here. So I am not, begging people to give me gifts. If you happen to go on there and you're like, oh, this would be cool, I absolutely would love to get a gift. And, I do plan to return the favor. So I think everyone should be making birthday Amazon wish lists, and then we can share them so that everyone feels loved on their birthday. And of course, I still have my free newsletter, Becoming Dr. Health Equity Jazz. A new issue will be out March 6th, and that also is a monthly newsletter. And you know, if you want to follow more about me, then you can pay. But again, keep your coins, okay?
All right, awesome. So be sure to support Jasmine there. And I guess like next time you'll hear me, my birthday will already pass, but maybe I'll create an Amazon wish list. So look out for that on Instagram at the PH Millennial.
Wait, are you a Pisces?
I am not. I'm an Aries. Sorry.
Oh,
yeah,
that's so sad.
No, it's not. No, it's not. But if you like to support me, support the show, support the platform, you can go to Coffee. So that's ko-fi.com/the PH Millennial and support there. You can become a monthly supporter. You can do a one-time support and like just buy me a coffee, support me. Greatly appreciate that. And if you want to buy some apparel, you can check out my store at thephmillennial.com/shop and join my LinkedIn group. That's where we're going to try to be active in it again. It's called the Public Health Millennials. We link it down below. I guess you guys can hear it first, but I'm closing down my Discord group. It was just a lot to deal with. So we're going back to LinkedIn, and we're going to be using that platform for now. So check us out there.
All right, so fun time. Well, I don't know. This isn't, you know what? We got to work. Next month is going to be fun. We are going to find all the fun health equity, public health stuff, because even this one is a little bit sad. So in case you missed it, it's still Black History Month, so, you know, we're wrapping up Black History Month for you. But Black Panther Wakanda Forever was released on Disney Plus in honor of Black History Month. If you did not see it in the theater, you might be a little bit, like, they did something with the video quality on Disney Plus is very bad. It's dark. So I hope that you saw it in the theater, and if not, then, you know, turn the brightness up on your TV, because Disney, they need to fix that. But anyway, you know, we're talking about culture, and you probably are like, wait, what does Black Panther have to do with Health Equity Monday? So if you're a Marvel fan, you know that Chadwick Boseman, we were all kind of waiting for this movie to see what they did to honor his memory, because he played T'Challa, and unfortunately Chadwick died on August 28th, 2020 from colorectal cancer. So I think you're probably getting the tie into health equity. So Omari, tell us what's going on with colorectal cancer.
Yeah. And before we go into colorectal cancer, I know that we had a conversation about like Black Panther and what that means for Black people, Black culture, and like just envisioning a future for ourselves, because a lot of the times that even in our conversations and what I'll share just now is like we compare Black to white, Black to Asian, different things like that, but we don't consider what Black health could be if we didn't have slavery, if we didn't have this oppression and these historical traumas built in. So I think this gives us the ability to envision a world where we are like just doing amazing things. Like, granted, we are doing amazing things in this world with everything that has happened, but just envisioning a world where what can health be, what can wealth look like for Black people in this world if we weren't disenfranchised, if we weren't plundered and raped and taken from Africa, stolen from Africa. So to get into the colorectal cancer, so I'm going to share some data from the CDC. The first thing that I think is really interesting here is that the data that we have for colorectal cancer stops at 2016. I don't know how often they collect it, but they don't collect it very often, interestingly. But as we can see here, we can see that when we look at figure 1, colorectal cancer incidence and mortality age-adjusted rates by sex, race, and ethnicity. And I'll let Jasmine explain what incidence and mortality is before we get into more data.
Oh, you know, I'm the vocab queen. So incidence is the frequency, the percentage, the occurrence of disease in the country. And then when we talk about mortality are the deaths. So unfortunately, how many people have died in the population and are no longer here.
Right. And I think a lot of times when we're in public health school, we learn about like incidence and prevalence, and I think a good way to remember this is think of like a bathtub, and whatever is in the bathtub is the prevalence of like how much this disease is or whatever the thing is in the community, and the incidence is the tap that's dropping water into the tub. So like what is that rate of this thing happening to create the prevalence of the disease. And getting back to this, okay, so looking at this figure 1 again, looking at males and their colorectal cancer incidence and mortality age-adjusted rates, we can see that black men have an incidence of 49.1 and a mortality of 23.0 per 100,000, while white males have an incidence of 41.4 and a mortality of 15.9. You see Asian and Pacific Islanders have an incidence of 34.7 and a mortality of 10.6. And American Indian Alaska Natives have an incidence of 32.7 and a mortality of 11.7. So we can clearly see that there's a disparity in the incident rate and the mortality age-adjusted rates for blacks versus whites versus Asian Pacifics and American Indian Alaskan Natives. We can just see that there is higher incidence and mortality for blacks versus any other race or ethnicity that was studied. I think it's just important that we continue to get this data, and this is interesting because the data is from 2016, so that's what, 7 years ago. Yeah, so as we can see, it'd be interesting to see what that data looks like in 2023 or just more recent, because I'd imagine that these rates are not the same and the disparities have probably widened, but I can't conclusively say that, and thus we'll just rely on the data that we have from the CDC to share that in 2016 the rates were higher for blacks versus other populations, other race or ethnicity groups.
Yeah, and honestly, even without the data, what we've learned from COVID is because of delayed care, there are more people that are presenting to need care at sicker states. And so it's very likely that this is going to be a consequence of COVID, of the pandemic, especially because colorectal cancer is usually found in the population at a later stage, depending on how well you're doing with preventative screenings. And again, another full episode could be on how hard it is to really get people into frequent preventative screenings to potentially catch some of this and the disparities that are happening within that as well.
So to that point, Jasmine just said, I think the CDC's graph with figure 3 really speaks to this, where they talk about colorectal cancer incidence and mortality by 5-year age groups. You can see that the incidence and mortality goes up to peak when the age group is 65 to 69 years old. And it's also important because a lot of black people tend not to have health insurance, are not getting frequent visits or checkups by a doctor, so they're less likely to recognize that they have colorectal cancer. And we all know it's always better to catch cancer earlier than later to ensure that you're able to fight it. So that just increases the disparities.
All right, no, honestly, the March episode has to be like lighthearted. I don't know what, y'all, please comment on things that are happening in public health that are like not as depressing as this, because we can't set the tone for our show to be like, depressing. I don't know.
Let us know if there are positive topics that you've seen out there in the health equity sphere that we can talk about or give our perspectives on. We'd love to share more about that. And be sure to subscribe if you've not subscribed as yet, then gotten this far. Share this with a friend. Share this with someone who is interested in health equity and interested in public health, interested in intersections, because they'll definitely get some value from this. So I appreciate y'all. And moving on to the last section, the equity in action quiz. And Jasmine got me last time. It was really hard for me to pull something that I think Jasmine is not going to know, but I think the question is really on topic for a lot of what we've been talking about today, and so it's a true or false question, and I guess before Jasmine answers, you all let us know your answer in the comments below. We'll love to know what you all think. So,
is this you said it's not a trick one, right? Like I'm gonna get this right.
you're probably gonna get it right. I'll be honest. I was trying to dig up many things, but it was just really hard to find something. I was like, Jasmine's not gonna know this, but Jasmine will probably know this one. Okay, true or false? Prior to the Civil War, half of the midwives in the U.S. were black women.
Oh, absolutely. Absolutely.
That was too easy.
I mean, it could have been 100% because, I mean, well, what were white women doing? They weren't taking care of their own kids.
That's true. They were indigenous and white midwives, but there were pushes from people from like Dr. Sims and Dr. Joseph D. Lee to really unprofessionalize the midwife and just share how unimportant they were, though they were like the primary caregiver, healthcare provider for black populations. And this was kind of the birth of obstetricians. It was the death of midwifery and the birth of obstetricians. And I know Jasmine spoke a little bit about that earlier on. And interestingly, in the article that we'll share as well, is that the same Dr. Sims, he would get insomniac-induced epiphanies that stirred him to like think about what kind of experiments he can do with black women. And this was all like the scientific quote-unquote basis that really pushed them to say, let's get these black midwives out of here and let's take control of this as the white men to be the gynecologist and the people to take care of women. And we can see just how that has birthed a lot of trauma. And it's really interesting to see how midwives and doulas have really like gotten a rise in more recent years. But prior to the Civil War, they were the primary caregivers for the black population. All right, that one was that one was too easy.
I try.
Yeah, and I feel like really... that in itself could be a topic we talk about.
I think we should. We should find a midwife or a doula to come on a show and talk to us, because I know I am personally 100% going to have a midwife and a doula because I'm trying to survive childbirth. And honestly, the more you know, it's just one of those things that nothing surprises me in this country. So,
right. Well, I guess I got to come back with a harder question next time because that was way too easy. So if you all have any hard truth or false questions that I can ask Jasmine, just let me know. DM me at the PH Millennial. I would love to hear those so we can make sure that like your boy is on top at the end of the year. You know, you want to be on top. So there it goes. But
no, because now I am up too. So
you are up too.
And next time March is my turn. So we alternate. So send me the hard one so that I can stump him again.
It sounds like I'm gonna get a point next month.
Okay.
I'm gonna be studying my equity in action stuff.
All right, y'all. So y'all have to let us know how we did. I know there was a lot that we talked about in this episode. It was heavy, and honestly, I want next month to be a little bit lighter. I think we could use some joy, right? So like, let's find the things that Black people are excelling in, and just turning it over. So let us know how we did. Send us comments. Both of us have links on our website, so you can go to healthEquityJazz.com/HEM, or you can go to the PH Millennial /HEM and answer questions about what you liked, what you didn't like, what you want to hear from us in the future, and how we can make this really exciting and fun for you.
Yeah, we appreciate you rocking with us, especially with my voice, me not being at 100%. That's probably why my equity in action question wasn't that good. Carnival, just have my brain in a tizzy. If you don't know what that means, we'll put it in the description. Check it out. But we thank you so much for rocking with us today. Look forward to sharing more episodes like this. Be sure to subscribe if you're not as yet. Leave a like if you're watching this on YouTube. Share it with a friend. We greatly appreciate that. It's the best and easiest way that you can support us. And we'll see you all next month.
Next month, March. And, wish us both happy birthdays because we're going to age in between talking to you guys.
Give thanks for the wisdom.
Yes. All right, y'all. We'll see you next month.
Peace, everyone.